Hello, and welcome to St. Louis University's webinar, Pre-Health at SLU and Applying to the Medical Scholars Program. My name is Andrea Hitzman, and I'm the Director of Campus Visits. I've worked in the Office of Admission at SLU for over 20 years, and I'm a two-time alumna. I'm excited to be your host and MC for tonight's event. This webinar will start with an overview of St. Louis University's Medical Scholars Program. Then a member of our admission staff will take you through the process step by step of how to apply to SLU, access your account in our portal, and apply to the Medical Scholars Program. At any time during the webinar, you may ask a question in the chat and someone will respond to you immediately. After our presentation has concluded, we'll continue answering questions until 7 p.m. Central Standard Time, but we'll do so live and share the responses with the group. So I'd like to start with introducing my colleagues. Dr. Gonzalez.
Hello, good evening, and thank you for joining us. My name is Eva Gonzalez. I'm the Director of the Pre-Health and Pre-Law Office here at St. Louis University, and I'm also a professor in the biology department, and I've been at SLU for 11 years now.
Cole.
Hi, everyone. I'm Cole Bleckley. I'm one of the academic advisors in the Pre-Health and Pre-Law Office. And yeah, I'm looking forward to the chance to talk with you, chat with you, answer your questions tonight.
Thank you, Rachel.
Hello, good evening. My name is Rachel Adelman. I am a member of the admission staff. I am on the regional team based in Northern California for St. Louis University. Thanks for being here.
Shayna.
Good evening, everybody. My name is Shayna Kinane, and I am a member of the admission staff. Like Rachel, I'm also part of the regional team based in the Chicagoland area, and I'm looking forward to hearing all your questions tonight.
Jack.
Good evening. My name is Jack Evans-Tuckey. I am an assistant program director for regional recruitment at St. Louis University in the Office of Admission. I've been at SLU just shy of 7 years, and I am based in the Northeast.
Demara.
Hi, everyone. My name is Demara Stevens, and I am a sophomore here at St. Louis University. I am studying neuroscience, and I work as an ambassador in the Office of Admission. I'm also a sophomore medical scholar.
And finally, Emma.
Hi, everyone. I'm Emma Kidwell. I'm also a sophomore who is working in the Office of Admission, and I am currently studying social work on the pre-law track.
Okay, great. Thanks, everyone. Give me 1 second. I'll get the presentation started. Everyone can see it?
I think we're good.
Okay. Take it away.
Okay, so I'm going to share this responsibility to talk about our program with Cole. We work together in our pre-health office. So I'll give you an overview of what the Medical Scholar Program is and maybe about the timeline. And Cole can then tell you about the resources that we use to prepare students for medical school and for the admission process to begin with. So Medical Scholar Program is an early assurance conditional program to medical school here at St. Louis University. What that means is that students learn early about their acceptance to medical school before other students who are not in the program start applying out to medical schools. And their acceptance is based on certain conditions of that program that we will cover today. So the main feature of this program is that it's an early assurance, and students who are invited into this program from high school, from the pool of high school applicants, will have a guaranteed interview at the end of their junior year of the undergraduate studies. And then based on their interview and their academic performance and other engagement, they might be invited into a medical school. To earn the interview, they need to maintain 3.65 minimum GPA, and we calculate that separately as cumulative for all the classes, as well as for math and sciences separately. After students are admitted, they also have to take an MCAT and score at the minimum of 508. Just for comparison, the average MCAT of students who are right now in their first year of medical school at SLU, their MCAT is 513. So while they'll have to study, it's not a really high bar to achieve this MCAT score. And obviously they have to graduate and have to complete their requirement coursework to enter medical school. So what does that look like for the students to be students in our program? In their freshman year, they will take general biology, 2 semesters of that, and general chemistry, also 2 semesters of that, and both of those are with lab. And then there is a specific medical scholar requirement. It's a 1 credit sort of an experience. We call that CP1 or Cura Personalis 1. This class also satisfies a core requirement for the core curriculum. And that's where we really start working with the students on more close basis. We see them once a week. All the sections of this class are taught by either myself or pre-health advisors or someone who works very closely with us, along with peer instructors who are upperclassmen medical scholars. To prepare for this class, we ask students to read a book over summer before they come to SLU. And I put a cover of that book on the slide. It's called Bellevue. It's a basically history of medicine and medical education in United States. And it's based on a case study of a New York hospital. Students learn about a lot of competencies and expectations and the historical development and so on. And so then we start building on that once we meet. So during the first year, while there is a requirement to take this biology and chemistry, that's true for all the majors, whether the students take a science or non-science path. There is no specific requirement in the second semester of the freshman year, but we ask students to meet with us. That's at least once a year to prepare for the summer. When they come back at the beginning of the sophomore year, we then go over the game plan that they create in the freshman year and the summer, and then ask, well, so how did it go? What do you need to still work on? And we do that in a class that is a sophomore seminar, which helps them to prepare for the medical school admission process. It has 2 stages. One is a committee evaluation, and the other one is then the actual medical school admission. The committee evaluation is a process that provides overall institutional evaluation of the students and their preparedness for medical school. We look at academic performance, and that's pretty easy. We'll just calculate the GPA. But we also get feedback from your professors. At least 4 of the professors will submit teaching evaluations to our committee. And then we talk about what kind of clinical experiences the student have. How did that student grow from these experiences? What is the commitment to service? What kind of engagement the student sought out to cultivate empathy and compassion and things of that sort. So once that committee process is concluded, then we write a letter and submit it to medical school, who then invite students in their second semester of junior year for the admission process. By the end of sophomore year, students should have a good feedback on where they stand with respect to that preparation as they go into the process in the junior year. And they also have to complete some requirements such as English 1900 and 1 math requirement on the calculus 1 level. And the rest of it is basically just continuing with their major study. So heading
Dr. Gonzalez, I was going to jump in with one thing
Yes.
there, if that's okay. I think one of the unique features of this program and the way that sophomore year is set up with that seminar class is that students get a lot of the early feedback. So you will get practice drafting your personal statement and writing your whole application from top to bottom, and then work closely with our office to get feedback so that not only do you know what areas maybe you need to improve, but actually how can you articulate your experiences and piece together your experiences in your writing in a way that can effectively conveys what you're trying to get across. So it's good practice like that sophomore year as you move into that crucial junior year.
Yeah, so that's exactly right. Thank you for adding to that information. And so once you get that feedback in a junior year, really mid-sophomore year, we still are available on one-on-one. We meet with students occasionally in small groups. There are peer instructors who have already been accepted at that point, and so on. So when students return to class in junior year, they will be ready for the actual committee process, which is composed of an interview at that point. And then committee members will meet and discuss each candidate and write that letter. The draft that they will prepare, as Cole noted, in their sophomore year will be due sometime in late fall semester as a final draft of the application. So that's really that value of having that feedback, having a rough draft in sophomore year, and then having basically a year to really work on it. And while we don't have another seminar or a class where we help them, we still are available to go and review their application and help them to prepare their final draft. The other requirement, other than going through the process of admissions and the committee, most students will take physics. There are some exceptions because some majors like biochemistry maybe or biomedical engineering may take physics at different time, but pretty much everybody was going to take physics. And then students will need to prepare for MCAT and take it in a pretty wide window, sometime between January and August. And it's really up to them how they schedule that. They can take MCAT twice. So if they don't meet that 508 minimum, they can take it again, as long as they schedule early. If they schedule their first attempt in August, then that would be hard to take it twice. So we would not recommend that. And then in senior year, they basically need to finish their major, and their classes have to include 2 upper level science classes. And then they graduate and they're ready to matriculate to go to med school. If students either drop out from that medical scholar program for whatever reason, or they're not in that program to begin with, they have an opportunity to earn an automatic interview as when they apply as juniors, if they meet the average incoming GPA and MCAT. So this year, that would be about GPA 3.8 and MCAT 513. And I think one thing I forgot to put on my slides, but I want to mention, is that we typically invite students to this program from high school. So you'll apply by December 1st, and I understand that you will have more information how to apply and when later on. But students who may have decided on coming to SLU later or didn't even know about the scholar program and so on, they can also try to enter this program during their freshman year or at the end of their freshman year. So there will be a second point of entry for some students, as long as they meet all the requirements as students who are already in the program from the beginning. Okay, I think I'll give it to Cole and let him tell you what is it that really our office does.
Yeah, that's great. So the first thing you'll see here is this term secondary advising. When you come to SLU, you're going to be first assigned a primary advisor, and that's determined by your major of study. So let's say you're a biology major, you're going to have a primary advisor assigned to you based on that major. Maybe you're a health sciences major, you'll have your primary advisor for that major. They're really here to make sure you're going to get your degree on time in the 4 years, make sure you're going to meet all the requirements on that track. But as a secondary advisor myself, I'm looking down the road. I'm looking at what are the prerequisites that you'll need to take for the MCAT and for medical school or whatever professional health school you're looking at. What are the prerequisites that we can fit those into your schedule? But also, what are the activities and experiences that you're going to have access to outside the classroom? We talk a lot about the medical school admissions model is a holistic model. When they evaluate applicants, they're looking beyond just your GPA and MCAT scores. Sure, those things are important. Like they want to know that you can handle yourself academically, but it's so much more than that. They're looking for students that have a background in clinical experience, in community service, leadership initiatives, maybe research, maybe work involvement, if that's something you're interested in. So a lot of my one-on-one advising is kind of directing students towards what those opportunities could be, but also helping them reflect on what is going to be most interesting and worth their own time. One really cool thing that our office offers is a peer mentorship program. It's called the Pre-Health Ambassador Program, and we lean quite heavily on these students. It's about 15 juniors and seniors, so older students that work closely with our office. They hold office hours, so current SLU students can always meet with these students and have like a one-on-one meeting that way. But they help us quite a bit when it comes to some of our offerings through the year, which is my next point here, the workshops that we do. We'll host a series of workshops through the year covering things like application tips to personal statement help. We do a couple panel discussions. So actually right now we're gearing up for So You Want to Be a Doctor. It's a big panel discussion where we'll invite 4 or 5 different physicians onto campus. They're going to talk about what it was like for them to get into medical school, or how they decided medicine was right for them, how they decided what specialty they wanted to go into, what their practice looks like now. So we're intentional with some of those workshops. We want to bring different guest speakers to campus so students can get not only a variety of perspectives, but some real world perspectives into some of these professions that they're interested in pursuing. One of kind of our logistical operations is our Canvas page. That is our main mode of communication with you all when you get here to SLU. All your courses will have a Canvas page, but our office also manages a pre-health Canvas page as well. So you'll get added to that Canvas page, and on there we send out weekly newsletters about all these activities that I'm talking about. If there is a workshop coming up, if you want to meet with the ambassadors, if there are service or shadowing or job opportunities in the community, you're kind of kept in the loop that way in our Canvas page. Coursework, I don't want to touch on too much here because I think Dr. Gonzalez did a good job talking about the CP1 class that scholars take as a first-year student and the sophomore seminar. We do offer kind of a companion to the CP1 class. It's called Intro to Health Professions that non-medical scholars can take. And that's a great way to kickstart your pre-health path. If you're not in that scholars program, you're afforded many of the same resources. It's just that class is offered in the spring, that Intro to Health Professions class. And then the last kind of major resource I definitely wanted to touch on today is our shadowing program. Because of our proximity with both SLU Hospital and Cardinal Glennon, the pediatric hospital, we can actually have students sign up through our office, and we'll help place you with doctors. I should add PAs too, if anyone's interested in pre-PA at those 2 institutions. So you can start working on getting your shadowing hours early on. And at least it's a good way to help find some of those connections if you don't know who you might reach out to otherwise. I always encourage students to reach out to family, friends, or their own doctors, but know that this shadowing program is in place to help supplement and find some additional connections if you need help on that front. So this slide, we're going to talk a little bit about what we're looking for when applicants apply into the Medical Scholars Program. And I can take the lead here. Dr. Gonzalez, feel free to add on anything I don't cover. But essentially, when a student applies to the Med Scholars Program, we're kind of operating under the same pretenses that the medical schools are going to be thinking about in the future, right? It's a holistic admissions process. It's more than just the transcript that you send to us. We're looking at a multitude of factors. Certainly, one of the first things we do want to see is the academic performance of the student. So when you submit your transcripts, we're really paying close attention to your math and science grades in particular. So you'll see here on the slide, it says, really no C's on the transcript, especially if it's a C in a math and science. Unfortunately, you just won't qualify for the Med Scholars program at this time. That's not to say you couldn't always apply at the end of your freshman year. As Dr. Gonzalez mentioned, there is a second entry track now. But for high school seniors looking to apply, we're going to review the transcript. And so we want to see really mainly A's and B's on that transcript. We do not consider ACT or SAT scores anymore. I know you may submit those for your general SLU admission, and I would encourage you to do so if you feel that is, if that's a score that you feel good about. But for the Med Scholars in particular, we're blind to that. We're not going to use that information in determining our selection. We're going to look at the student's extracurricular involvement, especially service background, and that comes out in the 2 essays that are required as well. And I would say that with extracurricular involvement, we want to see that you can balance a couple different things. We want to see that you can balance the things that you're most interested in, because you're going to be asked to do the same thing on campus. But special attention really paid to that community service piece. With SLU being a Jesuit school, it's not only something we value at the undergraduate level, but it's certainly something that SLU Med is going to be highly interested in when students go to apply there in the future. So we want to see that you have a background in community service. The 2 essays that I mentioned that you'll answer, you might touch on some of those pieces from your background. And there's 2 letters of recommendation we require as well, but I think those can just be the same letters that you would have submitted for your general SLU admissions application. Occasionally I get the question, do I need healthcare experience? No, not necessarily. I mean, sure, it's not going to hurt, but we don't look specifically for students that you don't need. It's not required that you have shadowing or other healthcare experiences. I think it's more important for a student at your stage to just simply follow what you're passionate about and engage in the things that are most interesting to you. For many of you, that might be healthcare, so that's cool, but it's not something that we need, absolutely need to see. It's not a requirement to apply for the program. So this was going to talk a little bit about the coursework we would want you to think about as a high school student. So not a lot of AP credit. Well, I should retract that. The real main areas where you're going to have to retake your sciences, regardless of AP credit, are the biologies and the chemistry classes. We're going to want you to take those here on campus. AP credit for anything else, it can definitely work for you. So you can bring it all in. The most common ones are going to be English 1900. If you have AP credit for that, that's great. Or occasionally students will bring in AP credit for Calc 1. That's great too. We will still have you take at least 1 math class on campus, despite any AP credit in Calc 1. But those are 2 classes that can potentially give you a little bit of a leg up. Not in the selection criteria, but once you arrive on campus. The thing that we would maybe is most important to point out, the thing that we're going to really recommend is at least getting a year of chemistry. Not only is that going to prepare you for the chemistry on campus, but frankly, it's going to be required in order for you to place into the general chemistry 1 that scholars are required to take their first year. So the real main class I need to see is chemistry. Some of these other classes can be to your benefit as well. So we mentioned the 2 entry points for you all. If you're in high school, if you're a senior right now, the thing you need to remember is December 1st of your senior year is the main time that most students are going to apply and join into this program. But there is a second entry where students who were maybe not admitted to the Med Scholars program, did not find out, did not apply to the Med Scholars program, they can actually join into the Med Scholars program at the end of their freshman year. There is an application process that'll happen at the end of the freshman year. Qualified students would be held to the same standards that the current scholars are held to. So you would need, if you were not in the program and you wanted to apply in later, you would still need to maintain that 365 that first year on campus. You would still need to take your biologies and chemistries just like a first year Med Scholar would be anyway. For those students, there's an essay and there's an application that comes at that point. And they're going to just join their cohort that they would have started with. So you'll just join the first years now in your second year, you're all in one cohort and you'll be interviewing with SLU School of Medicine junior year. We don't need to spend too much time on this because I know many of you are interested in applying as a high schooler, but just know that this kind of second entry door is open down the road too. Dr. Gonzalez, do you want to take the lead? I know I mentioned like kind of the general things, but is there anything else you would give advice for in terms of how one could stand out in this application process?
Yes, so sure, thank you. I'll just take over and make a few remarks here. So we obviously look for someone, as Cole mentioned, who is curious and loves learning and is dedicated. So as a good academic performance that shows on the transcript, as well as from the letters from your teachers from high school. But we want to know that you're not just sitting with your nose stuck in the books, that you go out and do something else. So I would say if you really want to be invited to this program, it is good to show us what else you do something out of your ordinary, just see you can stretch your brain and you can face challenges, or that you're curious, that you care about the community around you and so on. And so I think this is what we're going to look, that you are an engaged and sort of interested individual. And that's going to be your life here when you come here as an undergraduate student. Our students are pretty involved. I think if we have a chance to hear from the two students here, then you may hear what they specifically get involved in. But our students are very involved, and so we look for that promise in high school applicants. All right, so we'll be happy to answer your questions. Thank you.
Thank you. We will move in now into the actual process of applying. So I'll let Rachel take over.
Sounds great.
Actually, I'm sorry, I lied.
Yeah, actually,
this is
let me
still
just-
Cole and Dr. Gonzalez.
Yeah, we were not sure whether there would be questions about it. So there are 3 more slides. This is just a symbol of all the competencies that medical schools are looking for. And that was just in case a slide. And if you click down one more, there are texts for the prompts for the actual 2 essays. So the students who apply for this program from high school will write 2 short essays, and we don't look for anything involved. And we included those prompts here in case they want to think about it, and it's not available to them right now. So we really want to know about their experiences and background and sort of a broader community, and hear about their stories from their culture and family and so on. Mostly we just want to learn about them, who they are. And then the second prompt, which is on the next slide, is more focused on what you expect and where you're going, because we are a Jesuit institution, as Cole pointed out, and we wanted to basically assess how you feel that this is going to be a really good environment for you to thrive. So that's all I have to say now. Thank you.
Okay, thank you. That's great. Okay, now actually, Rachel.
Sounds good. All right. Well, now if listening to our great presentation and that sounds interesting to you to apply, and you have not yet applied for medical scholars, we'll go through that process now. So the first thing you'll need to be that you'll need to do is to actually fill out an application for admission, generally to St. Louis University. So you would apply in a few different ways. If you are a first-year domestic student who resides in the U.S. and has been taking classes all 4 years in the United States, as well as a U.S. citizen, you would be applying as new first-year student. If you already have some coursework that you've taken at a community college, or you've already graduated high school and have taken additional college classes, you would be applying as a transfer student. And then if you are a student either who is currently residing in another country or does not have citizenship here within the United States, nor have you completed up to 4 years of high school in the United States, then you would be applying as an international student. So once you click one of these options, it'll go ahead and ask you to choose a pathway for admission. So we have a few different pathways. We have early decision 1, early decision 2. We have early action and regular decision. And then from there, you would decide which pathway you want. Early decisions 1 and 2 are a binding admissions agreement, meaning that if you are admitted to St. Louis University, then you agree to be attending St. Louis University. It is a contractual agreement. So I usually only advise students if SLU is your number 1 and pretty much the only choice in your mind, then early decision might be a good fit for you. I will say, though, the majority of our applicants will apply early action, which has no binding agreement, no contractual agreement. It allows you to apply early and get the great benefits of applying to St. Louis University a little bit earlier. It is also a December 1st deadline, but again, no binding agreement there. And then the regular decision option is if you miss the early action deadline and you still want to be considered for admission, you can apply regular decision after that December 1st deadline. So once you pick a pathway, you're also going to have to pick a campus, right? We've got a few different options. We are very fortunate to have our own campus in Madrid, Spain. But to be considered for the Medical Scholars Program, you would need to select the St. Louis campus. So you would select St. Louis as your option. You would register for your account. Yep, fill out all that information. And then it will give you an email that looks similar to this. And you will click Activate Your Account with your temporary PIN seen at that email. And then from this, you would start a new application for St. Louis campus. Yep, grabbing that St. Louis. And then from here, you'll get another email that says, hey, we noticed you started applying to St. Louis University. We look forward to reviewing your application once it's complete. So then once you are ready to submit, you would press that submit application button. And remember, this is generally for St. Louis University. So if you're interested in pre-medicine, you would apply with your intended major, whether it's biology, whether it's neuroscience, whether it's public health, along that pre-medicine, pre-physician assistant, whatever it is you want to pursue later, and you would submit that application. And then from there, you'll get this great email that says, hey, thanks for submitting your application. We've given you access to your Billiken Gateway portal. So this portal is where you'll be able to track your requirements, view your status, update documentation, as well as submit your application for the Medical Scholars Program. So you're going to log into that Billiken Gateway portal through that email and click that link. And then from there, you're going to see this homepage here. And instead of Billy, it'll say your name. It'll say welcome, and you'll be able to see the actual status of your application in that bar there. So for this example, it says awaiting materials, which means maybe we have not yet received your transcript or we haven't received your letters of recommendation. So we send you reminders if we're missing materials, and then you'll actually be able to see here the status of your application if it's under review or if we have made a decision on your application. And just to note, you'll notice a few things on your right-hand side too of if you need to update any information for your application, you can do so there as well. So then if you scroll down on your Billiken Gateway portal, you're going to notice this bar that says competitive scholarships and programs. If you click that, you're going to see these two drop-down lists. Hold on, go back just 1 second. There we go. So you're going to see these two lists. You're going to see scholarships applications on the left, and you're going to see program applications on the right. So I highly advise you to look at some of those scholarship options as well. We actually just had a webinar last night that discussed the differences between those scholarships, and it will be posted on our website later for review. So if you missed that and you want more information, definitely watch that recording. But of course, for now, we're going to focus on those program applications. You see university honors right at the top. It's another great opportunity I suggest you look into. But if you scroll down, you will find medical scholars. So yes, competitive scholarships and programs. Yep. And medical scholars. So this is what you will see when you click on it. You'll get a little bit of a snapshot of that information with a link in case you need more information about the program. And then you're going to click that big apply button. From there, you'll be able to see a little bit more about the Medical Scholars Program, our eligibility requirements, and application instructions. So keep in mind with this specific application, we do require 2 letters of recommendation. And I know Dr. Gonzalez wants me to focus in on this because there are many times when students will apply to the Medical Scholars Program and we just don't receive those 2 letters of recommendation. They can't review you without those 2 letters. So keep in mind, we can use letters you've already submitted as part of your application for admission for your scholars program, but we do need at least 2. letters of recommendation on file. And correct me if I'm wrong, Dr. Gonzalez, but I believe we prefer that they are from teachers as much as possible. So if you can have a teacher write you a great letter of recommendation, please make sure you submit those by the deadline of December 1st, along with the actual application, which we see here in this next slide. Yep, so you'll, similar to those prompts that Dr. Gonzalez and Cole mentioned, you'll see those prompts there. We limit you to a certain word count. So I always advise students to take these prompts, copy and paste them in a Word document. Make sure you count your words as you are answering these questions, because we do limit you to the word count. And then where it says, please list all volunteer activities and leadership positions, go look at your, if you do have a resume that you've already created or your common application, pretty much bring all of that information into this space here, but try to organize it as best as you can with the time that you've done, the weeks and, you know, years if you've participated in those as well. So this is what we'll need in order to review you here. And then you'll notice at the bottom, you have an option to submit or save for later. So if you come into, this page here and you need a little extra time, you can't finish all of those essays right at the same time, you can always hit that save for later button, come back to it later, fill out that application. Just remember to actually come back and fill it out before December 1st, and then you'll press that submit button when you are ready to go. And once you press that submit button, this will come up on your webpage. It'll say, thank you for your application to the Medical Scholars Program. Remind you of some of those major requirements. So that's something else we always like to tell students is keep in mind there are some major restrictions with the program. But that being said, happy to answer any questions regarding that. And then you'll receive this great email that says, thank you again for your application. So you get that double confirmation that your application was submitted successfully for the Medical Scholars Program, detailing that same information. Okay, and that is how you apply to the Medical Scholars Program. I know we already had a couple questions in the chat, but if there are any last, questions that we can answer for you about the program, about the process, at this time too, I know we've got 2 current students on. Would we, Emma and, let's see, Emma. Demara, thank you. I couldn't find her. Would you guys mind just kind of coming on and maybe talking a little bit about your experience? I know, Emma, you're with our Law Scholars Program, but just being a scholar overall, the application process, would you guys mind talking a little bit about that?
Yeah, I'm totally okay with talking about that. I can kind of talk a little bit about my experience. I'm sure you're a little bit more interested in Tamara's on the pre-health track. But I will say that throughout my experience with the application, I definitely think that pacing yourself when you are applying, making sure you're not kind of time crunching it or procrastinating. I know it's so hard to do, but making sure that you really have time to really think about your answers and what you're writing down. Obviously, you want to present your best self in this application, but you also want to make sure it's authentic. So just really make sure you take that time to showcase that and showcase what you're proud of within it. But also, sometimes you might have to tweak down the word count, so you're not over, and just making sure that you have included everything that you think is most important to succeed on that application.
Yeah, and kind of going off of that, I think it was a great experience to be able to put together this application because it kind of shows you how far you've come so far, and it kind of sets a really great base in order to kind of expand upon that. And maybe, hey, where are my strengths? Where are my weaknesses? Where can I improve going into this new space with more opportunities, a great support system? But I think it was a pretty great experience.
Hey, Demara, while I have you as well, and I know Cole's already on here, so I just wanted to ask you how you feel your advising process has gone the past couple of years. What resources have you sought out? Do you feel like you are being as prepared as you possibly can going into this, this guaranteed interview opportunity?
Yeah, so it's kind of my answer to my why SLU question. With the Office of Admission, we're kind of asked to reflect on why did you choose SLU, and then also why did you stay at SLU? And my number one answer has always been support from all aspects of SLU. I mean, from my tour to this point now, I have felt nothing but uplifted from all of my advisors. Whenever you apply to SLU and if you make it in, you have a whole list of people like on your side automatically. You have major specific ones. Each minor you declare, you also have advisors. Any pre-professional path you're on, along with financial aid, you have a whole team of people who are all on your side. And with that, it makes it super easy to know where to go with any questions. And I think especially being pre-medicine, it's kind of, you feel like the competitiveness. However, I think it's a great support system from my peers as well, because we all uplift each other and help each other out. And I feel like I have had an amazing amount of support. I have had countless appointments and meetings with all of my advisors. I've gotten to know them. With SLU's student to faculty ratio, it makes it super easy to have those personal connections, which are so important no matter what you're going into and what field you're in. And I feel like I'm on a very great path. They do a great job of, like I said before, analyzing how you've made it this far, where you're currently at, and then making a plan for the future. If it weren't for those meetings and the constant reminders of how to build yourself up to be a good applicant, then I wouldn't be in the spot I am right now. I wouldn't know where my weaknesses like once lied and how I was able to work on those.
Awesome. Thank you so much. All right, we have gotten a few questions in our chat, which I'm happy to chat about. So one question is about when will students hear back from the Medical Scholars Program? So the deadline, of course, to apply is December 1st. And then we will turn around decisions in early March for students. And another question we got is there an interview required? There actually is not an interview required for admission into the Medical Scholars Program. So that just goes to show you how important, one, your transcript and how hard you've worked in high school proves, but as well as the answer to the essays that you have to fill out in that application. So take your time with those, give it your all, but as Emma said, make sure it does reflect who you are as a person authentically as well. I feel like our reviewers are very good at detecting if essays have been fabricated as well. So just be your authentic self. And then Dr. Gonzalez, I want to bring you back just for one question here. We're just asked about some numbers of how many students per year are accepted into the program, out of how many applicants, kind of some numbers overall.
I can't get back in.
We can hear you.
Oh gosh, I can't figure out. It doesn't show me the choice for video. So I'm just going to talk. Good thing you can hear me. You don't have to see me. So we receive between 600 and 700 applications, I would say every year, roughly. It varies from year to year, but that's about a rough estimate. And we don't really have a number that we meet with respect to who is invited. But typically, I would say up to 400 students get invited to medical scholar program, somewhere between 330 and 400. And out of those students, typically about 1/3 will accept the invitation, because those students who apply to medical scholar program at SLU are also successful in getting into other programs and getting scholarships elsewhere. So they don't all come to SLU. That's why we always admit or invite more than we expect. So overall, I would say about 1/3 of the invited students will come, which yields about 100 students or so, sometime a little over 100 in freshman year.
Perfect. Thank you. And I know I've gotten this question before from students of, well, is this a BSMD program? I feel like the term BSMD is very well known and at least publicized and almost a buzzword. If you're looking into medicine, I feel like a lot of people ask about that. And so the short answer is no, it's not a true BSMD program. In the sense that we don't guarantee a spot for you in the medical school. So we keep talking about this guaranteed interview, right? So that's how we orchestrate this program, is it is a guaranteed interview into the medical school, not a guaranteed spot in the medical school. And the reason for that is for one, we can admit more students. It's much more of a fair opportunity for all, but it's also a whole lot less competitive. And if you've noticed, we're trying to foster this community of support, as well as this service oriented. That's very much our Jesuit mission at St. Louis University. So I think this program really speaks to that, as well as more of just an early action opportunity. It's getting that stress off your shoulders a year early and allowing you to use your senior year to focus on research that you want to do, to focus on your classes, to focus on clubs and organizations that you may join at St. Louis University, and to really, you know, make sure that you've got that kind of lifted off of your shoulder. So Demira, I want to ask, you know, as you were deciding some of those, your college options, and you were going through, you know, that decision process, how did SLU rank with this program compared to maybe others you looked into?
Yeah, I was very unfamiliar with like the Jesuit mission whenever I first applied to SLU. I didn't fully understand what it meant to be a Jesuit institution, but these past couple years here, I have grown more and more in that understanding. And compared to friends I have at other schools and also just touring other schools and applying to other schools, I think there's a very, very clear difference and being able to go to a Jesuit university because of the whole person approach. Applying to medical school and being pre-medicine, a lot of other schools focus on STEM, which is very, very important, don't get me wrong. But here at SLU, you're also encouraged to get involved in the community and to take care of your own physical and mental health. And it's all those different aspects. Because again, whenever you're applying anywhere, but especially the medical school, they're not looking at this one piece or one page of your application. They're looking at you as a whole entire person. So that kind of stood out to me originally. And again, I've grown in my understanding of that. And I also loved the size of SLU because again, you're able to have those closer relationships with professors as opposed to some schools that are a bit larger. Again, pros and cons either way. But having those close relationships has been vital in my success, both in the classroom and also in different applications.
Awesome. That's great. Yeah. And I mean, something I know I've heard from alumni of St. Louis University, medical scholars, and SLU School of Med. I mean, I hear these great stories of them saying, you know, I went to medical school. I learned how to be a doctor, but SLU taught me how to have excellent bedside manner, how to have conversations with folks who you see often on their worst days, or, you know, you have to communicate a diagnosis to someone and it can change their life, right? And so I've heard, at least from our alumni, that is taught, that is part of the curriculum, that is something that they really focus in on, is that communication as well as that care of the whole person, that mind, the body, the spirit, and making sure their patients are cared for as that entire person. So that's great. I'm curious, Dr. Gonzalez or Cole, have you heard from faculty members at SLU School of Medicine, you know, how would they describe our undergraduate students who matriculate into the medical school as future physicians? You know, what are some characteristics they might describe them as?
So I can chime in, and Cole, you can complement to what I say, but I often hear that our students are very strong in demonstrating their commitment to service and cultural humility, sort of reaching out to others in need. And that is this foundational competency or a trait or quality of future physicians or healthcare people engaged in healthcare. So that's definitely goes along with what this Jesuit institution is about, and students who engage from the first week when they come on campus. It just becomes a way of life.
The thing I would add is the curiosity component too, right? And that's something that I think all med schools are looking for. But I've heard from SLU Med in particular, they always value that curiosity. I mean, signing up to be a doctor, you're signing up for a lifetime commitment of learning and staying up to date on medicine in the field. And I think they value seeing that curiosity when our students apply into their program. and the way that the opportunities are situated here at SLU is that students really have that flexibility and ability to pursue their various curiosities. Like Tamara said, well, something that she's interested in might be totally different than the other med scholar sitting next to her in class, but they're both able to kind of find and pursue their kind of true passions in that sense.
Awesome. And Cole, while I have you here too, I know a question just popped in about our minimum requirement for math and science for applying to med scholars. Do you want to speak to that real quick?
Yeah, it'd be easier to speak. I was trying to type it up while I was answering, but easier to just say it out loud to the whole group. The only minimum we need is a year of chemistry. And that's, again, just to place you in general chemistry correctly when you get on campus. Otherwise, I mean, I would say I would encourage you to take at least one math or science class every semester or every year. Like, I don't know that I would go a year or two without taking any math and science, because you're certainly going to need to demonstrate some good grades in those areas, but there's no requirement. We're not like counting up the credits to any other degree other than that year of chemistry.
Perfect. And then one more question for you, Cole, too. You know, you mentioned this curiosity of these students. Do you happen to have any or know of any students who are doing some really interesting research at SLU right now, or any research projects that you've currently heard about? Same with Dr. Gonzalez.
Most definitely. It seems like every time I'm in an advising appointment, a student's telling me about something I had no idea was going on campus, and they found something really cool. I'm thinking about some of our pre-health ambassadors, those upper class students that I said mentor on campus and kind of work in conjunction with our office. Many of them are involved with research, not only on the undergraduate campus, but even down at the medical school campus. There's an opportunity to reach out to faculty down there who are running their own projects and labs and get involved with some clinical trials on that side of things. We have students that do the wet lab stuff when it comes to biology or chemistry. We have students that do ecology research at Forest Park. We have students that do public health research, and they work on these big data sets and they look at the opioid crisis. We have students that do human participant research in the psych department. It kind of goes back to what we're saying about service or extracurricular involvement. There's not one right way to do research. It's really about tapping in and thinking about what it is that you're interested in and finding a project that aligns with that. But yeah, just the variety that I've come across with what students are doing, there's a lot of different options on the table.
That's great. Wonderful. I just want to see if there are any last minute questions. We've got just under 10 minutes left of our webinar. Are there any questions we have yet answered? Please put them in the Q&A section of the webinar. We'll take kind of those last minute questions as they come. If you decide, or if you realize you have a question and this webinar has ended, wonderful. We've got these links up for you for more information about admission to SLU, as well as the medical scholars and other scholar opportunities as well. You can also reach out to your admissions counselor for any questions that you have. If you've already applied to St. Louis University, you'll notice in your Billiken Gateway portal, there's going to be a picture of your admissions counselor with our contact information. So please send us your questions. We're happy to meet with you. There was also a question about that interview component for medical scholars. So no, there's not an interview for the medical scholars program, but we do offer optional admissions interviews that are used for general admission. So if you are interested in doing that, you can always set up an interview with us. And then we will send you more information on upcoming visit days that we will be having throughout the rest of the fall, as well as in the springtime. We will offer some admitted student opportunities, as well as some other options kind of moving forward there. And yes, we do have a question on if this webinar is going to be posted to the website. It will be. Andrea, do you mind clarifying exactly where they can find it?
Sure. It's going to be at slu.edu/visit, probably in about 3 days.
Perfect. Yep. So that second link down that you see on your screen. So give it a couple of days and you'll be able to rewatch all of this great information. Let's see, one last question we have received, and Dr. Gonzalez and Cole, I think this might be a good question for you all is, do you have any examples of what is considered, do something out of the ordinary? We always get asked about, how do I stand out on an application? What's, I know it's hard to give examples of this, but maybe what have you seen in the past? That might be a good answer to this question.
I can go first.
Okay, go ahead.
What's your ordinary? It's for you, it's going to look different than someone else. I would encourage you to maybe think about trying something that you've never tried before. That's kind of the common advice that a lot of our first year students will get when they get on campus, because there's going to be a lot of new opportunities and options and things to try that maybe you kind of had in the back of your mind that would be interesting to do, but you've never kind of put the pieces in place, or for whatever reason, the opportunity just never manifested. So try something new. It's not something I can't say, well, do this one thing, or then everyone would do that one thing. I would say, try something out of your ordinary, try something new. But I would also say this, don't spread yourself too thin. Like, I would much rather see an applicant who has, more time devoted to the things they're most interested in, or maybe they've tried something new and they devoted some time to that. But I don't need you to try 10 or 15 new things. I don't need you to have a laundry list of different activities where you're kind of jumping from one thing to the other. So it's okay to try things out, but ultimately you want to land and kind of concentrate your efforts on the things that are most interesting to you, the things that you look forward to. That really is what stands out in my mind on an application.
Yeah, I'm just going to maybe chime in a little bit. I agree with everything that Cole said. He made really good points. You got to be trying to figure out things that you care about, that you're passionate about. But med schools are looking for applicants who have a sustained commitment, that they really show they care about something. And for you to care about something, to show that, you really need to have something they're interested in. It's really hard to dedicate lots of volunteering hours when you don't have interest. So I don't even like to use the word volunteering. I want you to think about your engagement as something that you love. And let's say you think of community service, you think of it as a partnership where you give something, you serve someone in need, but you also gain and learn. So it is really a good idea with whatever you do that it involves social interactions with others, because that is also something that will help you to foster these competencies that med school is looking for. And that could be sport related, that could be literature related, or music, or I don't know, working with Habitat for Humanity, or just identifying some need. And then you can lead in solving the problem or contributing to community. So it's, as Cole said, it really is difficult. We don't want to tell you what to do, but we will help you when you come here to have conversation to discover what is the best path for you.
And then one thing just to add too is at least I've heard from students is major in something you are very interested in. I think a lot of students come in thinking, okay, well, if I'm on the pre-medicine track, I have to be a biology major, I have to be a chemistry major. And that's just simply not true. Yes, there are some major restrictions with the Medical Scholars Program, but actually, if you look at it, you still have 50+ major options with the Medical Scholars Program that'll work really well with it. And one of my favorite success stories of the Medical Scholars Program is I had 2 alumni of the program who matriculated on to SLU School of Medicine, ended up doing residency in different areas, come to one of my events in Southern California. One of them was a biochemistry major, medical scholar, did a residency at UC San Diego, and the other one was a theater major, medical scholar, and did a residency out in Chicago, but was visiting in Southern California. And I mean, talk about 2 drastically different majors, right? But they both were able to talk about how passionate they were about those undergraduate majors. And the doctor who had majored in theater, he's like, I'm a pediatrician, and the biochemist major was like, he's the best pediatrician you'll ever meet because of the major he focused in on as well, in addition to the medical scholars. So I always tell students, even if you come in bio pre-med, just be open to other majors and you might find that passion, you know, elsewhere too, and to get that high GPA and to stand out further as well. All right. I think we've got all of our questions completed for now, but I want to thank everybody who's been on this webinar today, and turn it over to Andrea, see if there's any last minute things.
Yes, thank you. We do need to end the webinar now, but if you want to see this again, you can go to slu.edu/visit in the next couple of days. Go to our website and reach out. Any of these folks will be happy to answer any of your questions. And thank you so much for attending tonight.